I want to show you the key elements of what the Prime Minister said in his address about an hour ago. First it was Tali Bajao, now the Prime Minister says Diya Bajao. The first hashtag was 5 baje 5 minute, now it's 9 baje 9 minute Sunday. The 5th of April, the Prime Minister asking people to come together, turn off all their lights, turn on their candles, their flashlights, their mobile lights, and really send a message that there will be light at the end of a very dark tunnel. Here is Prime Minister Narendra Modi speaking to the nation in this recorded video message this morning.
कोरोना वैश्विक महामारी के खिलाफ देशव्यापी लॉकडाउन को आज 9 दिन हो रहे हैं। इस दौरान आप सभी ने जिस प्रकार अनुशासन और सेवा भाव दोनों का परिचय दिया है वो अभूतपूर्व है। शासन, प्रशासन और जनता जनार्दन ने मिलकर इस स्थिति को अच्छे ढंग से संभालने का भरपूर प्रयास किया है। 5 अप्रैल को रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं। मैं फिर कहूंगा, मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट 5 अप्रैल को रात को 9 बजे 9 मिनट तक जरूर जलाएं। और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा। इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है। रास्तों में, गलियों में या मोहल्लों में नहीं जाना है। अपने घर के दरवाजे, बालकनी से ही इसे करना है। सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है।
So far we've spoken to psychologists on what the Prime Minister is trying to do. I now want to go across to a leading epidemiologist and understand from him whether there is any purpose achieved by the kind of societal experiment that we'll all be a part of. Dr. Kadar Babu joins us. He runs the epidemiology department at the Public Health Foundation of India. Dr. Kadar Babu, welcome. As one of our most acclaimed epidemiologists, can you give us a sense of, from a medicinal perspective, what purpose this Tali Bajao, and now Diya Jalao exercise serves?
Thank you, Rahul, for asking this very important question at the most critical juncture in the lockdown period. The call by the Honorable Prime Minister, if you see, is to replace the darkness with the symbolic lighting experience that the entire nation will have at one point of time. By darkness, from an epidemiological point of view and also from public health point of view, what we see is the kind of stigma, the kind of suspicion on people who might be having infections, the stereotyping of the healthcare workers that we see in the nation. This is the real darkness that we are facing. in addition to the kind of some breaches of physical distancing that we are seeing through the country. So by replacing that darkness with light means for a moment, every Indian now have to think, why am I lighting this? What is the reason? The common enemy is only one, which is corona virus. So if I have to fight against it, what are the actions that I need to do? So the message here is physical distancing with social cohesion. The social cohesion, this is being the light, whereas a stigma, stereotyping, and the kind of breaches that we are seeing is the darkness. So I feel this messaging and communication and using this platform of video to reach out to millions of Indians who are successfully participating in the lockdown is very, very important from a public health point of view.
Okay, stay with me, Dr. Kadar Babu. And this is where I now want to engage your deep expertise on epidemiology to try and explain to our viewers where we are at in the fight against the coronavirus. Now remember, the data that's come out just this morning suggests we are now on a 3-day curve. A 3-day curve on the trajectory tracker means that the number of coronavirus cases in India is now doubling every 3 days. Remember, and we've been saying this from day one, the critical effort here is to try and flatten the curve on your screen. Each of those lines represents a country and it shows you the speed at which infections in that country are growing. India is the dark, deep red. It's at the bottom of the screen right now. It was relatively, it wasn't very sharp for a while, but you can see from about the 10th of March, it's become much sharper. So where are we right now? Let me show you the big picture first, and then we'll get into a state-wise breakup. And then Kadar Babu can take us through what's happening and what to expect next. So I want to walk across to the India Today Data Intelligence Unit Corona India dashboard and show you the big picture in India's fight against the coronavirus. So I'll take the India numbers first. 2,511 confirmed cases, 69 deaths, 180. Let's just zoom in. I want to tell my producers, zoom in as much as they can so that our viewers can see these numbers up and close. So 69 deaths, that's the overall picture. The biggest problem at this moment is in the United States, where there've now been almost 2,45,000 cases with almost 6,000 deaths. Italy is the country that's second most impacted. That's 11 lakh cases, 13,000 deaths. Now let's look at the state-wise breakup. This is where Maharashtra is the state with the biggest problem at the moment. 420 confirmed cases, 17 deaths. Tamil Nadu, and we'll focus on Tamil Nadu in a big way in a moment, is the state that's seeing the sharpest spurt in the number of coronavirus cases. It wasn't deeply impacted by coronavirus till about 48 hours ago. Things changed, and that's the thing about the virus. The situation in a particular geography can change with a lot of speed. Very unpredictable, the spread of the coronavirus. Then there is Delhi, which again wasn't high up, wasn't as impacted as it is now. It's now the third most impacted state in the country. 293 confirmed cases, 4 deaths. Kerala is the one state which was impacted earliest, but it relatively speaking has the situation more under control than elsewhere, and I hope it stays that way. 286 confirmed cases, 2 deaths. So the number of confirmed, the ratio between the number of confirmed cases to deaths is also very low in Kerala. But the chart I want to focus on with Kadar Babu is the trajectory tracker. It will come up on your screen right now. I want you to absorb what you see, and then Dr. Babu can explain what's happening. So the chart's coming up on your screen right now. This is the state-wise breakup of the trajectory tracker. It's tracking the trajectory of the spread of coronavirus infections in every state. And what you will see on this graph is, okay, bear with me, that's not the graph I'm looking for. I'm looking for the state-wise graph of the coronavirus. Okay, so this is the overall national picture. Now that's the graph that I'm looking for. Now just reflect, absorb this for a moment, and I'll tell you what to look out for. The curve that you see, which we've highlighted, is the curve for Tamil Nadu. It's in red and it is on the left side of the dotted line. Now the dotted line is the reference baseline which shows what would be happening in a particular state if the number of coronavirus cases was doubling every 2 days. What you see in that graph is that Tamil Nadu is on the left side of the line, which means that the number of coronavirus cases in Tamil Nadu is doubling in less than every 2 days. The states that are in the middle of the two dotted lines that extend till the end of the screen are states where the number of cases are doubling between 2 to 5 days. So there you have Kerala, you have Maharashtra, you have Delhi, you have Rajasthan. Those are potential trouble spots as well. In Karnataka and in Uttar Pradesh, the situation at this moment is relatively speaking more stable. So Tamil Nadu is the biggest area of concern. Kerala is the one state which was deeply impacted, but the curve is more under control than it is elsewhere. Kadar Babu, you have access to far more sophisticated epidemiological models. Explain to our viewers the trajectory tracker. First, I'll start with the pan-India perspective. Data this morning shows the number of cases is doubling every 3 days, which means we're now in a particularly vulnerable zone in terms of what happens over the next 48 hours being very, very significant.
Yeah. From an epidemiological point of view, whenever you want to assess surveillance systems, there are two important things you would want to explore. Number one, as you clearly stated, hotspots, or the areas where the transmission is occurring at a faster rate and more people are getting affected. So your graph clearly shows that there are states which are showing doubling time really faster, and therefore we need to contain the transmission there. But what might be more counterintuitive, Rahul, and also very important to explore is the states that are silent on the states which are not reporting enough of cases. So in a few states, what has happened is there was no reporting of the cases earlier on, but later on, the death started reporting. When a death happens, that means the person would have got infected nearly 17 days ago. So there might be more infections in that state which we have missed, and now death, which cannot be hidden, will come out in the open, and therefore it gets reported. So the silent states are the hotspots in the future. So from an hotspots perspective, you will see where the transmission is high, number one. Number two, you will see those silent areas where the surveillance is poor. So lockdown gives this opportunity for us that, the rate of transmission has been reduced. Now we have to find every active case out there in India. It doesn't help only few states do well and few states don't do well. So there should be regular review of each state government's performance. We should not be really worried about the states which are reporting well, which means their surveillance system is functioning. We should be concentrating on containment measures there, and in terms of how to isolate those who are already identified. In the other set of states where the reporting is not so good, we need to be focusing on finding cases and isolating them, contact tracing, and then quarantining them. So by doing this, this lockdown then can be converted into an opportunity where we have not only reduced the peak of the transmission, we have also reduced the transmission per se by making very few infections in this country. That will be the best case scenario in the entire world.
Very deep and important insights you're sharing. You're an epidemiologist, and most people who are watching are just looking at that chart and making what they will of it. When I see that chart, I'm most concerned about Tamil Nadu. The sharp spurt that we've seen, would that be a major area of concern for you, or is the larger point that you're making that this could change very quickly, so you can't afford to let your guard down anywhere? Tamil Nadu is nowhere in the fray. Suddenly the number of infections skyrocketed, and that could happen elsewhere as well.
So there are few observations here. The viewers are definitely benefited in understanding that the public health system in Tamil Nadu is robust and very strong. And they can definitely mount a response both in terms of isolation of cases and also quarantining. So as an epidemiologist and a public health practitioner for long, I'm not that much worried about Tamil Nadu. They will handle this very well. And even Kerala, if you see, though they have a high number of cases, that only shows that their surveillance system works, and it worked much better than other surveillance systems. In EPI, we call early warning and a fast response. So if they're able to pick up the cases as early as possible, then they'll be able to refer them to treatment as soon as possible. So therefore, you see the mortality rate in Kerala, that is the least compared to any other state in the country, and probably the least and compared to any developed country in the world. So this means that the surveillance system and the system in terms of the overall containment in Kerala works. It works fine. So therefore, I am more worried about those states who are not reporting enough number of cases, but suddenly they have started reporting deaths. That means we are missing transmissions there. They will be the future hotspots. Once you remove the lockdown, these are the states where maximum number of people will be infected and they might spread it to others. So therefore,
Very important point Giridhar Babu just made. Now I want to just summarize this for our viewers. He's saying, it's states like Kerala and Tamil Nadu which have better healthcare facilities and therefore are more likely to be able to bring the epidemic under control. It's states like Bihar, like Uttar Pradesh, where public healthcare is weaker, where once the virus reaches, and it's inevitable that it will, that things can spiral out of control. What can be done now? We are seeing in the United States a massive mobilization effort on efforts to buy ventilators, efforts to buy personal protective equipment. Is that required in the Indian context as well at this moment, or do you think it's already too late for that, or should we still try and do whatever we can?
In my sense, whatever planning that has occurred in India is phenomenal, and the very early action that the government initiated, there are two things that we did. By ensuring a national lockdown, we bought ourselves plenty of time and opportunity to contain the transmission, and by planning really well for any potential surges in future. While doing that, currently all the state governments, very well coordinated by the Niti Aayog and also the ICMR and NCDC, we are in the process of preparing a plan if there is any surge in the cases. I'm very encouraged by the kind of planning done at the state levels, and then they're calculating in terms of what exactly they need if there is a surge in cases. Having said that, what is important here is how do we prevent the spread? How do we prevent these casualties that other countries are seeing? We have done reasonably well so far. If you compare the trajectory of Europe, US, and compare what's happening in India, even though there is increase in cases, we are at a lower rate compared to the exponential rise of the entire world trajectory. Your own graph showed that we are going progressively parallelly lower than the world's trajectory of cases, which means things are working fine till now. But will they work fine?
I want to ask you one question, which the data at this moment doesn't answer, but I want you to use all the wisdom and experience you have at your disposal to tell us what these charts suggest about the future. At this moment, India is in a 3-day curve, which means the number of cases is doubling every 3 days. Do you see this come under control? One thing that alarmed me was Tushar Mehta in the Supreme Court suggesting that a lot of the people, the government estimates that a lot of the people who went back to their villages could potentially have carried the virus with them, which is what the government said in its submissions before the Supreme Court. Where do you see the Indian curve go from here, sir?
Rahul, I think I'll be as good as anybody in terms of predicting what the outcome can be. But in epidemiology, we study in terms of the given data, what are the different possibilities. And I can definitely explain you the different possible scenarios that India can have. Number one, we have had a very successful lockdown. The first scenario is if we are in the remaining number of days of the lockdown, if you are able to focus on those states where we have not picked up the cases and transmissions really well and contain it, probably India will be the best case study for the entire world in terms of the least burden that we have. If we do not pick up those transmissions early enough, then we might continue in the same trajectory that we have for now, but that will be still at a much lower rate compared to the entire world is because of the initial measures that we have taken. The last one is if it gets out of control, if there are multiple hotspots, and I don't see that happening in India scenario. And therefore, all the projections assuming that things won't happen in India and it's a doomsday scenario for the country, I think they all did by comparing China or Italy or some other countries where the responses were one, late, two, they were not this coordinated enough.
Okay, I want to listen to what Prasoon Joshi is saying. He's put together a poem. He's reading that out for us. Let's listen to the chief of the censor board, Prasoon Joshi. He's written a poem on the coronavirus and we will try and have him with us and try and get him to read out that poem. So we'll do that when we come back on the other side of a quick break. Stay with us, we're back with a lot more. Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.